The reason I chose facial plastic surgery is because once you go for the face, there is no hiding. My dad was a surgeon. Back then there was no nanny. Sometimes I was sitting in the ER whilst my dad was operating next to me. I was fortunate to be trained by some of the best surgeons in the world. The better I got, the more I understood that what I'm really doing is I'm changing how people feel. Hairline lowering surgery is a procedure mostly performed on women with a very high forehead. By lowering it and creating the balance in your face, suddenly the attention sticks to your face and the beautiful features of your eyes, your lips, your nose.
There is a lot of stigma around plastic surgery, and I don't know, I wanted to do it because it's real results. I'm a real person from a simple person with a simple background.
Sometimes we make jokes and we say we are actually in the time-saving industry, because if you have had hairline lowering surgery, you don't spend half an hour every day fixing your fringe and taking hairspray and making sure that everything sits there. You just go out. We have two focal points in our face. It's the eyes and the mouth. Probably one of the most popular procedures is a deep plane lip lift. We equally do corner lifts. There are 3 different types of corner lifts. There are wing lifts, which is the segment on the sides. We can do lip reduction. We can do lip augmentation without any scars from the outside.
I'm kind of Greg's clinical right hand. I also assist during surgeries, so I'm there for every surgical case, and I work very closely with our practice manager, Talia.
I basically do everything apart from cut people's faces. Hello! Cutting in my shots.
So I'm everyone's first point of contact. So before anything goes on to Talia or Greg or Garrett, we've got to kind of make sure that I know what I'm doing, so I kind of lead them in the right way.
So my name is Alberto. I do like talking to my patients. I want them to feel that they can approach me for anything or ask me any questions they need.
I have 3 very simple rules, and I say this to everybody. I don't sell, I don't lie, I care. My responsibility for social media is to educate, and I think it's worth investing time and effort into this educational process because it allows you to learn something in your safe space. I had a patient who came to see me for hairline lowering surgery. She became very passionate about this whole journey and how much it impacts the happiness in everyday life. So she started a Facebook group for patients or women that are thinking about hairline lowering surgery.
It was all things that I'd asked before. And I just thought, if there's all these questions that I had, someone else might have the same.
So that is 2 weeks today, and that is how amazing it already looks.
I'm in the modeling industry, so a lot of my friends have had surgery. I've always had such an insecurity about my forehead. Within 10 days, I was wearing makeup and you couldn't even tell.
Finding out about the surgery was a real oh my God, I can actually do something about this. I think as well for me, I was so happy with the result. I had so many people message and say that they've looked to get into the surgery. They didn't know that this was an option. They've spent their whole life being really insecure about it. Kind of nice to feel like other people feel the same way, because it's always been a bit of a sort of oh, you just have a laugh and a joke about your big forehead because you can't do anything about it. And now it's oh, this is awesome that you can.
Nowadays, surgeons understand that you also have to see the patient and their mental well-being and their mental journey as they go through surgery. Because it's not just a procedure. As I said, my procedures change the way you feel. If this is something that has been bugging you, let's talk about it. If it started bugging you because you saw something on social media first, forget about it.